Hi, I'm Tari Turner. I'm Director of the National COVID-19 Clinical Evidence Task Force and an Associate Professor at Cochrane, Australia in the School of Public Health at Monash University. Welcome to TaskforceTV. I'm recording this today on the lands of the Boonwurrung people, and I pay my respects to their elders, past, present and emerging, and acknowledge that these lands are unceded. In this episode of TaskforceTV, we're taking a look at COVID-19 through the lens of rural and remote care. And I'm delighted to be joined today by Dr. Lorraine Anderson. Lorraine's a member of the Task Force Paediatric and Adolescent Care Panel, has been for the last 2 years. She's also the Medical Director of the Kimberley Aboriginal Medical Services, based in Broome, and she's worked in Aboriginal health and rural areas in Australia for more than 12 years, predominantly in the Pilbara. Thanks for joining me today, Lorraine.
Thanks for having me on the show.
Lorraine, as you know, in the last 2 years that you've been involved in the task force, the guidelines have grown to be quite big. There's now more than 170 recommendations. It's a lot for any clinician to pick up in one go. So I'm just wondering, what do you feel are the key messages, particularly for clinicians working in rural and remote areas, that are kind of the takeaways for the COVID guidelines?
Look, I think the key message is to actually know where the guidelines are and to refer to them when you need to. It's very important with the changing landscape around COVID-19, very important to know where to access those up-to-date resources as opposed to trying to memorise them, because they do tend to change quite frequently.
I'm interested, Lorraine, because I have very little experience in remote settings, and I know that there's such a vast variation of remote settings across Australia too, but also that the experience of COVID's been probably quite different for remote settings than it has for maybe in the more metropolitan areas. Could you tell us a little bit about your experience in Broome and areas nearby with the COVID pandemic?
Yeah, sure. So look, it's been a bit of a roller coaster at times up here in the Kimberley in particular. We've done lots of planning and lots of practicing for outbreaks, both in our town sites and in our remote sites. And this scenario testing has really stood us in good stead. We feel as though we were quite prepared for when the inevitable did happen. And it meant that when we started to get cases in quite high numbers in our remote communities, we had a very clear plan to follow and roll out, and that worked very well.
Is that different to what's been happened previously? I know we haven't had a pandemic exactly, but has the experience of having that opportunity to prepare, and has that been different to what's been done previously?
Look, definitely. I guess the difference is that having that time to prepare, and don't forget, we're in Western Australia, which means that we've had that extra time to prepare, and we've been able to tap into the experiences of our colleagues, in particular in the Aboriginal health sector in the eastern states. So having that sort of lag between what was happening in the eastern states and what happened in Western Australia, and in particular in the Kimberley, has given us time to really get prepared and learn from the lessons that were that sort of became available to us off the back of what happened over east.
Lorraine, I'm interested to hear about what's happening in the Kimberley at the moment. It's heartening to hear that you had that time to prepare and that those pieces were put in place in advance. What's happening now?
So what's happening now is that our numbers of COVID positive patients went down significantly about 3 or 4 weeks ago. They're starting to creep back up again, but when I say creep, I mean really creep. It's we're getting an additional 5 to 10 people per day, and we're not sure how much of that is actually off the back of the tourist season, which is in full swing up here in the Kimberley at the moment. Generally speaking, out in our remote communities, the numbers of patients that are now turning positive for COVID-19 is quite low, so very manageable.
And is most of that management happening within the communities themselves, Lorraine, or are people being taken out to health services that are further away?
Most of that's happening within the communities itself. In fact, initially, one of our plans was, as people became positive at the beginning of the pandemic, we did plan to to evacuate people into the town sites where there was better accommodation and closer to the hospitals. However, because we were lucky enough, if you want to call it that, to experience the Omicron wave, people weren't getting sick enough to require hospitalisation on the whole. And so it very quickly turned into a situation where we could enact our plan to look after people in the community and at home, and that's worked really well.
So, Lorraine, I'm interested in how the impact of the COVID pandemic has affected not just the communities that you work with, but also yourself and your clinical colleagues. Could you tell us a little bit about that?
Yeah, sure. So look, because we've had a good system in place for monitoring respiratory symptoms, the staff are very confident in their ability to be able to handle the outbreaks as they come along. That's not to say that staff aren't exhausted. I think we're starting to recover from that exhaustion at the moment. But they're also affected by catching COVID themselves. And with the number of staff that have sort of been taken out of the loop for a week at a time being COVID positive, that sort of put the rest of the staff under pressure, having to work long and hard hours. But I think at the moment, we're actually seeing a little bit of a reprieve and people are starting to catch their breath.
And the hot topic at the moment is really around the use of oral antivirals, particularly for people who have mild COVID. And I know that one of the issues in many settings is that they have to be provided early within the illness, in those 5 or 7 days of symptoms. Is this a problem in the remote areas?
We haven't had a problem with access to antiviral medication. The access has been very good. And even with the tyranny of distance, that hasn't played a role. We've managed the logistics of getting all of the vaccines out to our remote communities. And on the back of that, we had systems set up so that we could actually get the antiviral medications out very quickly. So we've got a very streamlined system. We've got antivirals in all of our remote community clinics. And so it's fair to say that anyone in a remote community in the Kimberley who tests positive for COVID-19 and is eligible for an antiviral medication has very quick and easy access to that medication.
So great to hear. Kudos to you guys for setting up those systems. That's a significant undertaking. I'm interested, Lorraine, in your reflections on what the differences are for caring for people with COVID who are in a remote or rural setting as opposed to those who are in a metropolitan setting. Any thoughts on that?
Yeah, look, remoteness brings with it a lot of challenges. So when and in particular when it comes to health, and around the COVID pandemic, we've seen a lot of centralised reporting and support. And so that sort of brought up some really interesting situations, in particular with welfare response. And so that's also required a lot of support from our end. And you know, no disrespect to people in the metro areas, but when people phone a hotline and get someone in the middle of Perth who tells them to go to their nearest Coles and they're about 500 kilometres from any supermarket, it kind of, you know, it makes people feel as though they're not connected. So we've done a lot of work around that and had very good connection with the welfare response people and managed to support people in our remote communities reasonably well.
It often does come down to those really practical things, doesn't it? And making sure that the systems we design meet everybody's needs, not just those of us who have Coles around the corner. Yeah.
That's right.
Are there questions that you're asked by your clinical colleagues that you think might not be asked by colleagues from a metropolitan context?
Yeah, there are. Look, I think that I think in general people are very keen to have a bit of a gauge on how long this is going to go on for. And that's a question that we'd all like to have answered, and we really don't have the answer to that. So we do still need to we do still need to encourage people to vaccinate. We do still need to encourage our staff to be very vigilant in terms of people arriving at the clinics with respiratory illness, and also with our staff wearing PPE when they're faced with those situations. So the questions being asked are probably very similar to what's being asked in the metro regions. I guess the big difference for us is that we know our communities, the population in our communities is quite small. And when we've got zero COVID in the community, we all know it. So it's a little bit difficult for the staff to maintain that vigilance and maintain the wearing of all of that PPE when they know that there's no COVID in the community. However, on the back of that, we don't know when someone is going to become positive for COVID, so we do just still need to keep our foot on the pedal in terms of preventing spread.
It seems to me, Lorraine, that you and your colleagues have done a fantastic job of preparing and managing COVID in these contexts. It strikes me that there's probably things that your Metro colleagues could learn from this experience. Do you think that there's things that you've learned as a result of the location that might be valuable for others beyond that context?
Look, I think that the most important thing that we've learned is that communication is absolutely vital. We've very early on in the pandemic forged some very good functional relationships with all of our interagency colleagues. So state health, as well as Department of Communities, Department of Fire and Emergency Services, WA Police. We've had very, very good communication right the way through the last 2.5 years. And that has been absolutely paramount in our ability to respond as a region in a very coordinated way. So I think communication and forging those relationships is absolutely vital.
Everything at the end of the day comes down to relationships, doesn't it?
It does, yeah.
I'm asking everybody this question at the end of the TaskforceTV recordings, Lorraine. What one thing, if you had a wizard's wand, what one thing would you change to improve the care of people with COVID-19 in remote Australia?
There is one thing that we need to change, regardless of COVID, and that's the overcrowded housing and the poor infrastructure in our remote communities. COVID-19 has just really highlighted how bad that is. We had houses where we had up to 17 people isolating in one house with one bathroom, and that's really very difficult to manage, not only on an infection prevention and control side of things, but also just in terms of mental health for people. 17 people in one house, not being able to leave, having food delivered that might not be the food that they would normally buy themselves, has really thrown up some challenges. So what would I like to see? I think we need to see that those houses and infrastructure are built for the future, to a really good quality with good functioning hardware. Things like bathrooms and laundries that we all take for granted in our homes, in particular in the metro areas and even in the town sites in the Kimberley. But in our remote sites, some of those things are actually really lacking.
Getting those fundamentals right is vital for everything, as you say, not just COVID-19, but well beyond.
That's right, yeah.
Well, thank you. And thanks everybody for watching and listening today. Don't forget to send us your questions. We've got experts like Lorraine on all sorts of topics. So if there's questions about COVID-19 you'd like to hear answers to, please get in touch. And also please share this with your colleagues and look out for our next episode of TaskforceTV. Thanks everyone.